Welcome to the deep dive. What happens when sweeping legal changes collide with, well, deeply personal health decisions? Today, we're unpacking a really critical intersection: the alarming changes observed in infant mortality rates in U.S. states that have implemented abortion bans. We're going to help you navigate this complex topic by drawing insights from rigorous scientific research published in JAMA, that's the Journal of the American Medical Association, also ground level reporting from the New York Times, and the sharp analysis of Qasim Rashid. Our mission, as always, is to help you become truly well-informed, quickly and thoroughly. We'll focus solely on the data and, what it means in the real world.
Right. And what's truly fascinating here, I think, is how these different sources, especially that really robust JAMA study, let us see not just what's happened, but start to understand why it matters, particularly for vulnerable populations. This deep dive should give you a clear, structured understanding of some complex public health data, letting you connect the dots between policy and actual outcomes.
Okay, so the Supreme Court's decision overturning Roe v. Wade back in June 2022, it dramatically reshaped the reproductive health landscape in the U.S. The big question then became, what would the actual impact be on public health metrics? That JAMA study, published February 2025, gives us some pretty stark answers. What did this subsequent research, specifically this major study, actually find about infant mortality in states with these new bans?
Well, the research is quite comprehensive. It looked at data all the way from 2012 through 2023 across all 50 states and D.C., and it specifically focused in on 14 states that implemented either complete bans or 6-week abortion bans after the Dobbs decision. The findings, they revealed a pretty clear association. Infant mortality rates were higher than expected in these states after the bans went into effect.
Higher than expected. So we were talking about an increase in infant deaths. Can you give us the specific numbers from the JAMA study? Just how significant are these figures?
Absolutely. The study estimated an increase of 0.33 additional infant deaths per 1,000 live births. That's above the expected rate of 5.93. So to put that in perspective, it represents about a 5.60% relative increase. And this translates to an estimated 478 excess infant deaths in just those 14 states during the specific months the bans were actually in effect.
Wow, 478.
Yeah. And it's also worth noting Texas had a big influence here. They implemented their ban earlier, and because it's a large state with longer policy exposure, it really pulled those overall numbers up significantly.
Those numbers are incredibly sobering. But the real depth of this issue, it seems to come out when we look at who exactly is most impacted. The research didn't just stop at overall stats, it dug into these disparities. The New York Times report mentions specific groups, too. What did the studies reveal?
Right. The findings consistently showed the highest mortality occurred among infants who were Black, or lived in southern states, or had fetal birth defects. For non-Hispanic Black infants specifically, the observed mortality rate was almost 11%, 10.98% to be precise, higher than expected.
10.98%.
Which led to an estimated 265 excess infant deaths among Black infants in those states with bans. And this is particularly significant because, Black infants already experience more than twice the mortality rate compared to white and Hispanic infants at the baseline.
So this policy change seems to be widening an already really deep health equity gap.
It certainly appears that way based on this data.
And breaking down the causes, what about the role of congenital anomalies, birth defects, in this increase?
That was another key finding. The data pointed to a notable 10.87% relative increase in infant deaths, specifically linked to congenital malformations.
Okay, nearly 11% there, too.
Yeah, and it raises that important question. Why this specific cause? The study suggests it's likely due to the continuation of pregnancies involving non-viable fetuses.
Non-viable meaning?
Meaning conditions making survival outside the womb impossible or highly unlikely. Pregnancies that might not have continued if abortion access remained. This finding gives a sobering insight, really. Policy restrictions, even if intended to protect life, might inadvertently increase suffering and mortality when they remove medical options for managing these very difficult pregnancies.
Right. It highlights the complex ethical and practical challenges doctors are facing now.
Exactly. And as Elissa Belinsky, a health policy professor at Brown, mentioned in that New York Times piece, the groups most likely to end up having children because of the bans are often the same groups already facing circumstances that lead to higher infant mortality rates. It's like a double hit.
These statistics are undeniably grim, but they really prompt that deeper question. Why are we seeing these outcomes? What are the underlying mechanisms connecting these policy changes to these tragic increases?
Well, if we look at the bigger picture, The research points to several contributing factors.
Yeah.
First, as we just discussed, the continuation of pregnancies with severe congenital malformations leads to more infant deaths shortly after birth. Second, the bans can also limit access to necessary high-risk pregnancy care.
How so?
Well, navigating the legal exceptions, fear of prosecution, potential delays in care for emergencies, it can all exacerbate maternal complications, which are themselves linked to adverse infant outcomes.
I see.
And furthermore, the bans disproportionately affect populations already facing significant barriers to healthcare. So you see a shift in the sort of demographic composition of births towards those groups who are already at higher risk of infant death.
So it's not just one thing, it's a combination of factors.
Precisely. And the JAMA study even found a really strong correlation, 0.77, which is statistically very powerful,
Right.
between the estimated state-level increases in fertility due to the bans and the state-level increases in infant mortality.
Okay, unpack that correlation a bit. What does that suggest?
It suggests that the infant mortality rate among those, quote, excess births, the births presumed to have happened because of the bans, was nearly 4 times higher than the overall average infant mortality rate in those same states before the bans.
4 times higher. That's staggering.
It is. It points towards those births being concentrated among populations facing higher risks.
And this aligns with some of the analysis we saw from Qasim Rashid. He pointed out that, 3 years after Roe fell, what many feared seemed to be confirmed. He noted physicians had sounded the alarm well before the Dobbs decision, right?
Exactly. It's crucial to remember these concerns aren't brand new. This wasn't entirely unforeseen. There were prior studies. For instance, Tulane University research back in 2018 warned about increased maternal mortality. And a 2021 Colorado University study pointed to rising pregnancy-related deaths in states with more restrictive policies. They were essentially setting the stage, providing early warnings based on existing trends.
So the medical community saw this coming based on previous data and trends.
Many did, yes. They highlighted these risks for years, and the current data, unfortunately, seems to confirm many of those predictions.
And Qasim Rashid's analysis also highlighted some really striking survey data from practicing OBGYNs that really brings it down to the ground level.
It does. For example, over 64% of OBGYNs surveyed reported that the fall of Roe has worsened America's maternal mortality crisis.
A crisis which, let's remember, already saw the U.S. with the highest maternal mortality rate in the developed world.
Exactly. And more than 68% say treating pregnancy-related medical emergencies has just gotten harder.
Harder how?
Sometimes requiring legal consultations before they can even provide urgent care. Imagine that delay.
Wow.
He also points out over 70% of OBGYNs report worsening racial disparities in reproductive health care, again, hitting those equity issues. And while statistics paint the broad picture, sometimes it's a single story that really drives it home. Rashid highlighted the tragic case of Adriana Smith in Georgia. She suffered a terminal illness but was kept on life support for 6 months, essentially as an incubator, just because she was 6 weeks pregnant.
That's incredibly distressing.
Yeah.
It really illustrates the real-world impact these policies can have on individuals and their medical care.
It does, profoundly.
And just to underscore the stark disparity across states, Rashid also cited CDC data showing that 15 of the top 16 states with the highest infant mortality rates are states restricting or denying reproductive health care access. While conversely, 12 of the top 13 states with the lowest rates are states that protect access.
The contrast is quite stark when laid out like that.
He put it very bluntly. A child is 3 times more likely to die in Mississippi, which restricts access, than in Massachusetts, which protects it. And the New York Times reporting echoed these trends, didn't it? Adding those individual stories and provider perspectives?
Yes, their investigative work really painted a picture of the challenges healthcare providers are facing on the ground. It made it clear this isn't just about abstract numbers, it's about real lives and difficult medical situations.
So what do these findings truly represent for you, the listener? Beyond the, frankly, alarming statistics, these insights paint a vivid picture of how sweeping policy changes can have profound and crucially uneven impacts on public health. They directly affect families, they reshape healthcare access, and they definitely exacerbate the persistent challenge of health equity in the U.S. It really highlights this intricate web connecting legal frameworks, medical practice, and the well-being of entire communities. So just to recap, what we've uncovered in this deep dive is that following the implementation of abortion bans in several U.S. states, infant mortality rates demonstrably increased, with a disproportionate impact clearly on Black infants, those in southern states, and infants born with congenital anomalies. The research points to a complex mix of factors continuing high-risk pregnancies, challenges in healthcare access, and it confirms many earlier predictions from medical professionals.
Right. And these insights really underscore that understanding complex issues like public health requires a critical look at the data, absolutely, but also a willingness to explore those connections between policy, demographics, real-world outcomes. The findings strongly suggest that legal exceptions in these bans, well, they may not be enough on their own to fully mitigate the adverse effects on infant health, which prompts us to consider the broader implications, for public health infrastructure, for support systems.
Which leads us to the final thought for you to consider. What does this research truly imply for the future of public health policy? And maybe more importantly, what does it imply about the support systems needed for new parents, especially in those communities already facing higher risks? It's a critical question, I think, for all of us to consider.